I'm the staff attorney at the New Mexico Commission. On behalf of the Commission, welcome. Thank you all for joining us today. We are thrilled to be putting on this CLE for you this morning. A couple of housekeeping notes before we begin. If you are here in person, please make sure you sign in at the hall table outside. If you have not done so already, you can sign in on your way out after the presentation. If you're joining us virtually, please sign in by putting your name and bar number in the chat box. So if you attended UNM Law in the last 8 or 9 years, you may have had the privilege of taking a course with Professor Meyer. If not, today is your lucky day because she is joining us this morning as our moderator for this presentation. Professor Meyer speaks, writes, and teaches in the fields of constitutional rights, criminal law and procedure, and education law. And she'll be leading our discussion today about secondary trauma and compassion fatigue in the legal field. And now, without any further ado, please join us in welcoming Professor Arantoni.
Not going to say that. I'm so grateful to be here and so excited about the work of the Commission. I think it's important work, and I'm happy to support it any way I can. And today, I'm really just serving as moderator. I'm going to introduce our main speaker. I have some questions set for him, but he is very eager to hear from all of you and is open to taking your questions throughout the course of this presentation. So don't feel like you have to wait till the end. So Brian Meyer, PhD, is a clinical psychologist, trauma expert, PTSD, SUD specialist, and was involved in developing the new best practice standards for trauma response in courts at the SAMHSA's Gaines Center at the national level. He's the psychology program manager for community-based outpatient clinics at the Central Virginia healthcare system. And I just learned has lived in Albuquerque before, so we're happy to welcome you back to town and very much looking forward to your presentation. Thank you for doing this today. And I also want to thank Dr. Shade for her amazing work to bring you here and make this all happen. I understand this is the first CLE that the Commission has offered, and that's really exciting. I hope it's the first of many. So, Dr. Meyer.
Thank you. Yes, please feel free to interrupt along the way. I lived here for a decade, 1992 to 2002, and I try to come back every chance I get because I have to go to the meetings. And that's where I was for lunch yesterday. So it's like I'm in the right place. And then we went and we walked the trails of the city. Yes. And I felt like I was home again. It was great. It's great to be here. I have done a lot of work in a lot of different subjects. I am a clinical psychologist. Once upon a time, I was the deputy clinical director of protective services for CLE in the 90s for a while. And we rewrote the child abuse laws, literally, because there were so many problems with it. And we were able to get an additional 30 positions out of the legislature, which was pretty remarkable because we had a Republican administration at the time. And they were saying they will help these positions, and instead we got to raise them. And so we did some really good work in getting some actually statistically valid stuff. It's not there anymore. You come 30 years later, all looks different. So my life has been working in trauma. I started working with children and adolescents, and eventually shifted on to adults, and now work with veterans in VA, and I've been doing that for the last 16 years. And you'd be astonished at how common trauma is. We do know that about 60% of people have experienced trauma in their lives. I will not ask for personal information, but I will sometimes survey the audience. Raise your hand if you've ever been in a car accident. Okay, so actually that's more than usual. I wonder what that means. I'm not going to make any more comments. A car accident is a potentially traumatic event. However, for most people, it is not a traumatic event. And the reason that it's not a traumatic event is that most people do not experience injuries or death as part of the accident. However, when that happens, that's when it becomes traumatic. You can't define an event as traumatic until you know how it affects the other person and you understand the contextual pieces that are around it. This part is part of what we call the trauma responsive course. Okay? Now, this is how the idea of trauma responsive, and I'm just looking at Molly about this. The idea of trauma responsive course is basically that we have been talking about having trauma informed courts for the last 15, 20 years. And done a so-so job, frankly. I get to go around the country giving talks, and so I get to see what different parts of life. And I was in a state last week where I asked how many of you all consider yourself a trauma informed courts, and one person in an audience of 200 raised their hand. Not a good sign, right? And that's consider themselves. And when I talk with people about, trauma informed courts, and I start asking them about, well, what do you do that makes you trauma informed? I discovered that trauma informed is one level. However, the cutting edge is now what we call trauma responsive. And in trauma responsive courts, the difference is that if you're trauma informed, you know about trauma and you know how that affects people. And in trauma responsive courts, you know what to do about it. It's the actions you take. That's a whole nother subject. That's 4 lectures. There's a lot of stuff that is going on at the national level. And this is a piece of it, okay? And I've been talking about this stuff literally since 2015, and nobody was paying attention. And finally, 3 years ago, I cold called somebody from the Gain Center, for those of you who are interested in mental health. How many of you are interested in mental health substance use and how that affects people's law? Yeah, all of you need to go to the Gain Center website, okay? Because that is the national place where this all happens. And so I cold called somebody at the Gain Center and I said, can we join forces and push this stuff forward? And now we do learning collaboratives. Learning judges here? No. Any court coordinators here? One court coordinator. We do free national trainings. And I'm the lead subject matter expert for the national training. The Gain Center puts it out in December. And we're right now in the midst of our 3rd one. And people and courts get not only a lot of training on responsibilities, but also get free 16 hours of consultation from national experts. It's pretty cool. In fact, I worked with somebody from the last year. She's been secondary traumatization is part of the trauma response because in the trauma response we understand that the people who work with the people also can be secondarily traumatized. And I'm going to talk to all of this here. I want to be clear, these are my views and nobody else's views. I got a message last week that I was no longer allowed to put the fact that I'm a psychology program manager, that that's my house, and so I said consultant. I'm not allowed to do that. It's really crazy. It's really crazy what's going on. And these are copyrighted materials. The only reason I do this is because I discovered that at least 4 times people have stolen my materials and claim them as their own. Which I think is really, that's really bad. I found a law firm once. I found one of my slides. military sexual trauma, and online, and I clicked on the slide, and clicked a law firm. And they used my work to attract clients who have been subject to military sexual trauma. Had to send them a cease and desist. I mean, it's amazing what goes on. It's wild and low. Anyway, you can use these for your own purposes. You can use them for your own course. Then I asked them to contact me. So, what is the problem that we face? So, how many of you are familiar with what used to be called the National Association of Workforce Professionals and is now called? Well, that's good. Okay. So I've been one of their consultants and trainers for many years. And I asked them, can I do a little survey at the conference? And they had all sorts of rules about what I couldn't do and what I couldn't dance. But I asked some simple questions. And it wasn't convenience samples. I had 500 to give out, and 404 came back, which as a return rate on any survey is astonishing. It is astonishing. And I had 16 questions pertaining to traumatic experience, not all of which I can tell this for you. So that was pretty good. And this was one of my questions. I wanted to know how many people had been exposed in their work to details of traumatic stress. Not just the fact that, they might have been sexually assaulted or physically abused, but rather they talked about it. And you have any guesses what percentage of people? 85. Someone else. 195. Y'all pretty good. I'd say. The answer is 98.5%. So we already have potential for people in our, at least in our treatment boards, treatment board, that we know almost everybody is going to hear about these details. Which, by the way, is one of the rules that you should not ever do in a trauma responsive court because of all the reasons. We have to be careful about this because it means that if you've done, how many, let me ask you all, how many of you have been exposed to details of traumas? Yeah, that means everybody. Okay. Everyone. And here's the thing, law school did not teach you what to do. How many of you had a course that went on to secondary traumatic stress and how to deal with it? I'm about to give you the course in a condensed version, okay? That's what I'm doing. I won't get into detail on everything, but first, we have to know what we mean by trauma, okay? And this is about being trauma informed. And the details come from substance abuse and mental health services administration, and this is their definition of it. I won't read it to you, but we can call this the definition of the 3 B's. First, you have to have an event. Something has to happen. I know that sounds obvious, but I work in a world where people can be paid, veterans can be paid, if they have PTSD resulting from their military experience. And so veterans can go online and find, believe me, there are all these websites that say, this is what you need to say, so that everybody will think you have PTSD and you can get paid for this. And they're trained for this. And I've been with people who they're very good at giving the long list of their symptoms. All the problems that they have. And I say to them, well, where did this come from? Well, my girlfriend left me. Not the trauma. Or my parents left me. It's distressing. It's not a trauma. The word trauma has been so deflated in our common discussion. I mean, people will say, oh, my boss yelled at me today. I was traumatized. That's not what trauma is. The trauma has to be physically or emotionally harmful or life-threatening, which really means basically life-threatening or sexual abuse. That's really what it comes down to. However, just because those things happen, that does not make it a trauma, which is what is interesting. I mean, policemen and women, people in emergency services, our soldiers who go overseas, they all experience events that we would consider to be traumatizing, but don't necessarily show up with the next two. So the next part is that it has to be experienced as threatening. You know, you talk to, I work with a lot of firemen who just came out of nowhere. So I spend a lot of time working with them. And if I ask them, you know, about the times that they were involved and where their life was threatened by the building, the burning, they don't get traumatized by that. It's only when they find people who are severely wounded then. And so it has to be experienced as harmful. And the final E in this definition is it has to have lasting negative effects on them. It has to change their functioning in some kind of way. What does lasting mean? More than 2 weeks. Okay, you could be in a car accident and not want to drive again. My son was my wife borrowed my car once, and she was picking up my son, and she got into an accident, and the car hit his side. He was in the passenger seat in the front, just you know the mistake you're supposed to do. And so he was highly distressed because he started having nightmares, he had flashbacks. He did not want to go back into a car, and most of all, he did not want to be driving a car. That's avoidance, again, a primary trauma symptom. And so, but it only lasted 2 weeks, you know, and we got him back up on the horse and said, okay, it's fine, and we got him driving. So it has to last more than 2 weeks. So, if you have all 3 of those characters, all 3 of them, then you experience something we call post-traumatic stress. That is not PTSD. It can be subclinical. And so I want to talk about what really happens. I'm a psychologist. Sorry. So here, when you experience a trauma, and someone experiences a trauma, your brain is flooded by stress hormones. We call them corticosteroids because in the medical field. And corticosteroids give your brain a bath. And later, when you have more of that, it will give your entire body a bath. And it affects 3 parts. And so one part is here, and that's called the amygdala. And it is a small almond-shaped, sort of like the top of my thumb organ. There's actually 2 of them. They are in the hard bones, behind the hard bones behind the ear. And deep in, because they are part of what is called the limbic system, which is something that is built in the first in utero and in the first 12 years of life. It has some very important implications for some people that we've seen, which I'll talk about later. The limbic system, when you're in the amygdala, it's basically, it's your threat response. So how many people remember how many people remember Space Family? Okay, yeah. Ooh, that's good. You remember Space Family Robinson? Not too many young people remember. They had this robot. He was Robbie the robot. And whenever something would happen, he would go, danger, danger, Will Robinson, danger, danger, Will Robinson. And that's your own. It is screaming danger. And it is giving you only 3 possibilities And you don't get to choose which one you do. Fight, flight, freeze. That's it. And I work with veterans, and I will hear these stories, when people go out, and there's lots of macho kind of stuff that happens where people say, oh yeah, I'm going to go through all these people, and you discover that whatever people's predictions are, they're not right. They're not right. People don't really know what they'll do. Although in the training that happens, they train people, as the Marines will say in their commercials, to run to the fight. In other words, they train people to decrease the flight and decrease the freeze. But if you've ever been on a battlefield, and are there any? Thank you very much for protecting me.
Thank you for paying your taxes.
That is the best response. If you've ever been on a battlefield, you'll see all three. Some people can't pull the trigger. Some people run away. Some people run forward. And what the training is meant to do is get forward to run forward. You don't choose. If you have ever been in a moment of trauma, and you see what your response is not your choice. It's not like your mind can override your memory. Because as I'm going to show you in a moment, actually your decision-making ability is overrun. The amygdala itself makes your decision. And this leads to a lot of embarrassment and shame. Because they think they're going to be able to stand up. And they don't necessarily. When I was 21 years old, and I was in Boston, and I lived in a mixed gender household. And one of the people in the household was coming in late on Sunday night on a plane, and it was well known that it wasn't always a good idea to be on the trains, subway, late at night, because it could be dangerous. And I was trying to do the right thing, and I said, I'll meet you at the airport. We go to the airport, and we walk down to the airport subway station, which is next to, at that time, it's next to a community called Charlestown, which was at the time actually not a very safe place. It is different now, but then, that was so I went to pick her up, we walked down, and we're standing there talking with each other, and suddenly a person comes up to us and sticks a gun in my chest, hits me with the gun, and says, give me all your money or I'm going to blow you away. That was fun. And it was very interesting to see how she and I responded totally different. I knew a lot about trauma even then, when I was 21. I'm a child of a Holocaust, and a lot of my family. And the message we were drilled with was you have to observe and report what happens, which is a lesson for all of us. Observing and witness was the word. And because that had been drilled into me so heavily, I was suddenly witnessing. That's not even one of those three responses. But I had a whole lifetime of that, okay? And when you have a lifetime of having something drilled into you, you can do it, and it can actually override your amygdala. So I memorized this guy, and I can see him right now. He's 5'8", he's 185 pounds. He has big muscles and a tattoo on his left arm, and an earring in his left ear, and a thin shaven beard. And I can remember everything about that. And for 2 years, I chased that guy in court because I saw him in a mugshot and had a flashback, a true flashback, right back to him. And it was like, okay, I know who this guy is. And actually, they knew, the police knew who this guy was. And eventually they did catch him, and it took 2 years. And he finally ended up in prison in Walpole. However, my friend froze. He was weak. And when I went upstairs, after they left, went upstairs and called the police. It was not unusual for this to happen at this particular place we discovered. Great, why don't they do something? Let's do that. She couldn't remember anything. She had dissociated. Her mind was left behind. And she was not present. She couldn't remember anything about this. She couldn't even remember that he hit her in the neck. He grabbed his neck and supported her. And she was living in the house for the summer. And at the end of the summer, she moved from Boston. So she moved to California. He was far away, she was possibly dead. And she never spoke to any of us again. That's it. That's supposed to be. How would this work? So that's the amygdala here. Attached to the amygdala is something called the hippocampus. It is a tube, and you can think of it as mainly being the postal service for your memories. So what happens to us normally in life is that, especially when we go to sleep, we have something called rapid eye movement, our eyes go back and forth, and we process whatever the bad things in the day are, which is why you often dream of bad things at night, and it gets put away in irrelevant things don't get so much put away in memory. What did you have for dinner 3 weeks ago Tuesday? Who knows, right? It's hard to remember. Not relevant. But if I pick something relevant, I could give you examples, but I don't think I want to spend all my time on that. So basically what happens is that all of those corticosteroids shrink the hippocampus. So the memories do not get filed. Traumatic memories don't get filed. And that's a huge problem. It's almost as if this tube shrinks and the memory is too big for it and can't fit through the tube. And that's why it comes back in nightmares and in flashbacks and in getting triggered when you have your own trauma or secondary trauma, which can be triggered by hearing about the details of something's. And so the hippocampus doesn't function right. And the other thing is this part of the brain, right behind the forehead. It is called the prefrontal cortex, and actually it's the part on the side, three-word warning, dorsolateral prefrontal cortex. So right here and here, this is our spot. Okay, it is where we're logical. It's where we have reasoning in our brain. It is where we anticipate the consequences of our behaviors. It is where we assess risk and where we stop impulses. And in a trauma, it shuts down. It shuts down because your brain is only trying to help you survive. And this amygdala will help you survive. But if you sit there and think, oh, this is what I need to do. I've got somebody who's getting just done. And he says, and I sit there and think, like, you need to do it in order to survive. Too late. Too late. So it doesn't allow that. And so you have this very interesting problem because parts of the brain actually become different under post-traumatic stress. Now, if you are exposed in any way to traumatic stress, that includes seeing it. You see pictures. I used to look at CLE and see pictures of abuse children. Okay, and I cannot get them out of my brain. I cannot unsee. Okay, so hard. Some of the things that I saw. But I figured out how to do it. By the way, there is a I did have PTSD after that event. day that I was on the and then my post-traumatic stress went away because I was sick. It was amazing, like light. And you were exposed. Oh, this is hard to do because we've got all of that up there. This is hopelessness. The sense that one can never do enough. This is something I see in my attorney and judicial practice a lot. And so what happens when they're exposed to too much trauma? You know what they do? Work harder. It's really interesting, which is part of how you get to learn. Hypervigilance, which is where you pay attention to your surroundings and look forward. Diminished creativity, so much for the art. Inability to embrace complexity, which can be a problem in some of the legal cases that we all deal with. Minimizing, oh yeah, that is me a whole lot. Chronic exhaustion and physical ailments. Start getting sick. You know why? Because of the stress hormones sitting in your body, and they keep getting pumped out. And then what happens is it starts to break down your body. Bessel van der Kolk wrote a very famous book, now called The Body Knows the Score. It became a bestseller during COVID. It was meant for people like me. I know Bessel, I read the book, and it is a good book. But, you know, it gets a little heavy on the detail for people who aren't clinicians. But the body gets it. And if any how many of you are familiar with ACEs? So ACEs are the perfect example. Because what happens is you start, with traumatic or negative possible exposures, and then what happens is you get this chronic neurochemical bath in your brain, and it starts affecting you, and it affects your physical abilities, your cognitive abilities. And then, because you're so concerned with danger coming from the outside, you're not easily able to pay attention, and you may get diagnosed with, for example, ADHD. Many people with the kids here. Useful. And we give them stimulants. That's what we do. And I can't think of a worse thing you can do. Just take somebody who's overstimulated already and stick them on stimulants. And there's lots of data that shows that we actually do mistake the phenomenon we call complex PTSD for another talk. That happens usually starting in childhood for ADHD, which is really bad. Inability to listen or deliberate avoidance. So think about if you really didn't want to go to work.
No.
Never. We never experience those things. Those things increase, and the likelihood of the decision being made is to stay home as opposed to go into work on that day, or taking, as we say, a mental health care, which I think is fine, by the way. I think that's a fine thing to do. But that goes way up. Dissociative moments, to take an example of that, a sense of persecution. That's not always the case. That's the least likely of these things to happen. Guilt, a lot of guilt. Fear is flight. Anger and cynicism, fight. Inability to empathize or numb. I can't stand it. I don't want to feel it. I numb out. And some people numb out just psychologically speaking, and other people numb out by moving to addictions. They start drinking, they start using substances. Grandiosity, where you start feeling like your work is so good and other people don't appreciate it. None of us.
Where does sleep disturbance fit in here?
Okay, so part of it, sleep disturbance is part of chronic exhaustion, because sometimes we're so tired we can't sleep, or we're not sleeping well and we get exhausted here. What we have on it, even though this is a very good, this is the best I've found, it does not have on it the level of nervous agitation where you're nervous and you're on edge and you feel like you want to jump out of your skin. If anybody has ever had a panic attack, you know exactly what I'm talking about. And so I would have put that nervous agitation there. And the nervous agitation is too simple. Any other questions? So, trauma exposure is the transformation that happens within us when we're exposed to traumatic stress. It is a continuum, and continuum, you know, you're sort of the stoplight version. You're ready, you're fine, you're in good shape, okay? And then a stressor comes, and you respond to the stressor. And depending on how bad the stressor is, and depending on your own resilience, which I will talk about in a minute, you may either react, irritable, angry, anxious, too tired, can't sleep, just right there, and you don't have fun anymore. Well, that's the mildest version of post-traumatic stress. That's the mild version. The moderate version is what we call the injury. And I use the term, I don't like the term disorder because this is a normal response to an abnormal event. So I don't like that. But injury, it does. I'll show you how it injures the brain. And so life threat, loss, inner conflict, wear and tear. Here you get the bigger things, panic, like rage, loss of control of your body or mind. You lose your mind, goes away. That is increased. Can't sleep at all, nightmares, all sorts of things. And then you get to the most severe stuff, which you have something that is actually a disabling condition like PTSD, depression, anxiety, or substance abuse. Okay, so this is essentially a spectrum. There are no hard lines between these different things. It's a complete spectrum. And so that's the spectrum of post-traumatic stress.
Can I ask a question?
Yes.
So, could you go back to the last
Sure.
So, when you're treating somebody, are you trying to get them back to like normal, or is it considered? I mean, it's moving back to something less serious, like injury, back to also part of it.
When I'm treating somebody, I want these things to go away. These things, they should no longer have this. And for most people, I can tell you, I can get them back to here. Depends how long I have. That's a very important issue. And what treatment I use. This is not a treatment lecture. I don't have any slides about all that, but I'll take it in the question. Hold that question if you want to know what we do for treatment. But really, some of them, particularly the ones with traumatic brain injuries, their brain has a double injury, and those people, I try to get them to this level because it's very hard to get because they really have severe brain injuries, not just changes. Are people familiar with post-traumatic stress disorder? Do you want me to go? Does anybody? Just let me. It's okay to be honest. Do you want me to go over what the characteristics are? Yes. Okay. So here are the characteristics. Ooh, no, that was not. So you have to have an event. Okay? And I said that before. And then 4 categories of potential symptoms come about. One is repetitive re-experiencing. That's the nightmares, flashbacks. It's intrusive images that come into your brain that you can't keep out of your brain. It's intrusive thoughts that come into your brain. ones about yourself. And that leads me to avoidance of stimuli associated with trauma. Why do they avoid it? Because they are so hyped up. Most people who have PTSD, one of the things that is very characteristic is you find that they have one safe place. And usually that safe place is in their home. And it is not the home. It is a room in the home where they feel safe. And they kind of take over that room. And they kind of clean up that room. Avoidance can happen in many, many different ways. It can happen because you don't want to think about it. You don't want to talk about it. You avoid talking about what happened to you. It can come because you stay away from places. I didn't go to Boston subway station for 10 years. It took me 10 years. When I came back, they had redone the whole thing. It was very weird. But it was unnecessary. It was totally unnecessary. Now, it was necessary at the beginning. Don't get me wrong. I wasn't going to go back there anytime soon. But the fact that I lived in Boston, but I felt like, no, I'm not taking that subway ever. And I've taken the subway. It's fine. So you avoid all these things, including things that can potentially trigger you into having inflammation of your own response. Oh, and this also includes substance use. That's always important. And the amount of cannabis and alcohol, substances, you should read what New Mexico's law says about medical marijuana. It's a whole other subject, a whole other talk. But you should read it because I've read it. So, yeah, like one of those things is true, and all the rest of 20 years of false. And negative moods and cognitions, which are thoughts, that is to say, the negative moods are basically the anger, there's the fight, anxiety or fear, there's the flight, there's numbing that gets in there, that's the freeze. And in addition to that, it's depression, which is usually a shutdown mechanism that moves you towards freezing. You stay in bed all long, you're frozen. You're not living your life, you're not functioning. And thoughts are things like, I'm a bad person, it's hopeless, there's nothing I can do, I'm evil. I've had some of my patients thought that they were evil for things that they did. And then finally, increased arousal. And that's all the stuff that's happening in the body. That's the feeling like you want to jump out of your own skin. It's when somebody touches you on your shoulder from behind, you jump. You have strong startle responses. The anger and the irritability fall under this. The insomnia falls under this. All of those are increased arousal. So if you want the DSM criteria for PTSD, it's very interesting because in this, you can have direct exposure. In other words, it happened to you. You can see it. In other words, it happens to the person next to you or nearby you. Or you can hear about it indirectly. And an indirect exposure, usually in the course of professional duties, first responders, collecting body parts, morticians, professionals repeatedly exposed to details of child abuse. There's a huge burnout. And it's because dealing with that and seeing it over and over again just rises. It just rises. So you can actually develop full-fledged PTSD. But I'm saying most of it happens on a continuum somewhere along the way. There are other forms of post-traumatic responses, adjustment disorder, the stuff that lasts not very long, an acute stress disorder lasts less than 30 days, and the wisdom of people that we have the difference between acute stress disorder and post-traumatic stress disorder is literally one day. I don't know what happens on day 31. I want to know what is it that makes it so different. It's a very silly one. But it exists in the DSM. Other trauma or stressor related disorder, which is really subclinical PTSD, you have some of the symptoms, but not all of the symptoms require the okay? And you can have complex PTSD, multiple traumas, multiple different kinds of traumas, experienced usually over time unless they are ethnic cleansing or torture. Those are the two exceptions. All you need is one example of that, and you can have complex PTSD already. And usually it starts in childhood, and usually behind it. So, if you get exposed, one of the things that happens to you is that you can get triggered. Now, this doesn't mean that you're PTSD, but you can be triggered. So, this is interesting because criterion B in the DSM says that you can include intensive prolonged psychological distress at exposure to internal or external cues and marked physiological reactions to cues that resemble or are like that, whatever that initial stressor is. Okay? So, again, this is how you get to, you can get all the way to PTSD. It should not be minimized that what you may see and do in your work can make you develop full-blown PTSD. Now, I'm not saying that's going to happen. I want to be really clear. But I'm saying if you do it long enough, and depending on your resilience, you can be affected by it. So what do we mean by trigger? It really means something reminds you of the traumatic event. Something reminds you of it. And then a person has a strong or emotional or physical reaction, and the brain and the body react as if the trauma is happening. As if it will happen. And your reactions, as with the amygdala, are involuntary. They're involuntary. You don't choose it. Nobody wants to feel that way. Nobody wants to have a panic attack. However, you can. It's a possibility. There are different kinds of triggers. And you should think about these things in your own life. The first one, a movie, a book, or a news article. So one of the things that I learned to do. So I work with traumatized people all day, every day, for many, many years. I've been doing this for 34 years. So it's a lot of and I come to the point where I have to measure my cup. How full is my cup? And there are days when it's like, I will not read another news article today. I just can't take anymore. And that's a healthy response to be able to say no. And if you're stressed out by the news these days, it is also a healthy response not to doom scroll on your phone and keep doing that. Why? Because it eats away at you. Every bit takes a little bit more of your reserves you have in there. Somebody talking about details of their trauma, I said, oh, good, okay, that was everybody in the room, and probably just didn't happen once, it's more than once. Anniversaries of traumatic events are really potent. And the amazing thing about anniversaries, the body has its own clock. And people will start, I will be working with people, and they'll be new to me, and I'll be working with them, and they'll have something unexplained. I'm always looking for, what the day before might have been created in the way of triggers. No. And then I'll say, is this the anniversary of something bad happened? And they say, yeah, how'd you know? And it's not that I wasn't reading mine, it's just that I know that there are anniversary effects, and the body knows it if the mind is avoiding feeling. So the body is very painful in the body. So things like, and this is for veterans, they hear a car back or they hear a jackhammer or a balloon popping or the sound of fireworks. All of those are the kinds of things that take them right back. If they go near the site of a traumatic experience, I have a lot of guys who get very traumatized by potholes. Potholes. They get triggered by potholes because of IEDs. And so those things make them really nervous. They will literally try to hold the way around the pothole, or they will take different routes. Smells. Smells are actually the strongest thing. Smells are the strongest link to memory, more than any other single sense. And so if you smell something, jet fuel is really big. The smell of jet fuel takes you right back to the so different smells. Those are external triggers, but we also have internal triggers. In any emotion can be a trigger. I felt this way then. Oh, I'm back in it. Feeling helpless or vulnerable, intrusive images or memories, negative thoughts about yourself, physical pain, muscle tension, all of those kinds of things that are internal can also be triggers. And so how do we react? I mean, you're back to it, flight, fight, this is shut down, this is flight, this is helplessness is shut down, pain is also shut down. These are the common emotions that you get. And then you get these actions here, like you run away, or you threaten, or you start cursing at somebody, your heartbeat is going up, you start to sweat, you shut down completely, and you hide. I have a guy who I twice a day, and he loves coming to me. And once every 7 or 8 weeks, he comes up. I go, what's going on here? And I'll call him, he's hiding something. I don't know. He's not answering his phone. I call his wife because he's giving me permission. Oh yeah, he's in bed. Or he's sitting in the shower. He will sit in the shower for hours. I'm glad to say that she's getting better, and so getting past the body. Dissociating where the mind leaves the body. I mean, literally, our minds do. And we have a continuum of dissociation. People think that this is a pathological thing. It's actually not. How many of you have ever gone into a room and you've forgotten why you went into that room? Right? You just have a little bit of dissociation there. Sorry. But that's not pathological, right? It's not going to ruin your functioning. How many of you ever, this is my favorite for me, I'll reach my hand into the refrigerator. My hand will stop. Don't reach into the bowl. Okay, some of you recognize that one as well. All right, we're going to move down the continuum. How many of you have ever driven down a long road, usually a straight road, for a period of time, and you forget what has happened for the last 30 to 60 minutes, and you're still alive? Wow! Your mind left your body, but your body kept you alive. That's pretty good. By the way, the first two that I mentioned, those are 2/3 of reported of all people. That's normal behavior. Okay? The highway hypnosis one that I just mentioned, that's about 33% of all people. So about 1 in 3 people. So it's a very common thing to experience. And then you get to the extreme. I work with a person who went to she's really bad dissociation from horrific sexual abuse. And all she has to do is feel angry or sad, and she's gone. And if she's angry later, she finds out, usually because she wakes up and there are many broken things around her. Or she has a fiance, and he'll tell her what she did during this period. And when she's sad, she can't tell her sadness. She was very connected to her father, who was a man who had schizophrenia and was murdered in a group home. Um, and so sadness is intolerable for her because it means the loss of a dear one. And so her brain will go away, her mind will go away. And I've treated lots of people, for example, promiscuous and sexual abuse, and what will happen is their mind will float up to the ceiling, and they'll be looking down on themselves. And it's a distance. They can see what's happening. All of those are kinds of dissociation. Freezing, we talked about, and the body tension. So you can get all of them. So just because you get upset about something, here's another word we have put into common parlance, and it is not what we mean psychologically speaking. Getting upset does not mean you are triggered. Oh, yes, I was triggered because my phone worked. Not a trigger. It's not a trigger when we have a difficult situation. That's normal. Some of them we have strong reactions to. That is also normal. And learning to regulate yourself in those is part of healthy emotional development. Where trauma triggers are different, this is dissociation, losing sense of time, space of yourself. Emotion is amplified, or completely muffled, or unrelated to the situation. They're like a trauma. Another result of exposure is what we call secondary traumatic stress. Secondary traumatic stress is the emotional upset that happens when you hear about the first-hand experiences of somebody else. That's the details that I'm talking about. Any trauma-responsive court, rule number one, never, ever, ever discuss the details of a traumatic experience in an open courtroom. It's none of anybody's business. If somebody needs to testify because this is something where someone else did something to them, it doesn't have to be in an open courtroom. You can have a smaller group of people, and they can do it now. This has symptoms that are not as severe as post-traumatic stress disorder, but they fall into the same symptom categories of PTSD. Why do you have a lot of trauma? Well, we all have a certain amount of what we call resilience. And resilience is simply the ability to bounce back from something bad. It doesn't mean you don't have bad things happen to you. Anybody have a life in which no bad things happen to you? Because I want to meet you. I really do. Resilience is something that is built. It is something, and I will talk about exactly how in a moment. You can increase it, you can decrease it. And the thing about resilience is it's not a trait. We have this idea somehow, I don't know where we got this idea, that somehow you're born with a certain amount of resilience. You say that's a really resilient person. It's not like that. Resilience is a set of skills and behaviors. And I'm going to unlock the keys for that for you in a little bit. But this is what happens to your arousal system. Okay? Now, this is something that Bruce Perry once made a diagram. It looks like this. I even imitated the colors. But he only had one trauma. And I wanted to illustrate what happens when you have multiple traumas. So each of these great things are when you have experienced a traumatic event. On this side is an arousal scale. And in this case, it's the fear part of it. So this is from calm to terror. But it could equally be the rage part of it, which is from calm to violence. Okay, that's it. So it can be either one of those. And this is time as you go this way. Time goes this way. And so what happens is we all start, unless we have really, really irritable temperaments, when you have the first trauma, unless it's a really extreme trauma, is boom, your arousal system goes up. And if time passes, your arousal system begins to come down. Okay? And then you hit another one if it doesn't get all the way down. And if you hit this next one, it goes up higher. Your arousal system goes up. And this is actually what's called your sympathetic nervous system. The top half of it is where you move into your sympathetic nervous system. And that is where you're activated for physical action. Or, anybody ever walked up to the edge of a cliff? What happened when you walked up to the edge? Scary. What? Thrill. Uh-oh, watch out. Someone else. Your feet went numb. Absolutely. Your feet went numb. Anybody sweat? Yeah, you sweat. Your heart rate goes up. Your heart starts beating fast. This is your arousal system. And your amygdala is screaming, danger, danger, Will Robinson at you at that moment. And what did you do when you were at the edge of that? Not you. There are people who actually do that. But for most of us, what do you do? What did you do? You step back. And what happens when you take it 5 steps back? You feel better and your arousal system calms down. Yeah, that's what this is. Your arousal system going down. That's what your arousal system is supposed to do. It says to you, get back. Get back from that. But if you freeze at the edge of that, that's not a good thing. But if you have another traumatic event, and you're coming down, and then you have another one, say a 12-year-old girl whose stepfather or mother's boyfriend is sexually harming. Boom. And the problem is that the arousal system stops going down. Basically, it goes down a little. And so now you're always in that sympathetic nervous system. You're always in either terror or rage. That's it. You don't have all other options. And imagine if you were in terror or in rage all the time. All the time. Did anybody see in the news that Virginia Giuffre committed suicide or something? Okay. I can believe it because this is intolerable to live a life none of us can. And that's when we start getting terrible diagnoses that aren't real diagnoses that are written down here, like borderline personality disorder. But the real truth of the matter is, if you look at the data, the 81% of the people with these so-called borderline personality disorders have histories of complex PTSD. That was Virginia Giuffre. She had complex PTSD starting very young age. You see these things I'm saying in our news media. So, yes.
Is schizophrenia one of the diagnoses that occur in the same way that the borderline personality?
No. The ones that, the two that are most associated with histories of trauma, a borderline personality disorder and antisocial personality disorder, which are also the two diagnoses that can be like thought. And I'll tell you, as a person who has looked at this problem for a long time, and I now come to believe most of them, there's a small group of antisocial personality disorder folks who are miswired, and you can tell them very easily. They don't feel pain because the nervous system is not working. And that means that mirror neurons in the brain also do not when somebody else is in pain light up, which is the source of memory. That's what comes from mirror neurons. We copy behaviors and we copy feelings. And if you don't have those mirror neurons working, you don't feel pain. So like, there's nothing to mirror there. And that's probably about 10 to 15% of those people. They have true antisocial personality. So I do believe they do. But it's a wiring. It's a miswiring. It's not like using the I mean, I can diagnose for you, I can describe for you what personality is in 4 words. We don't like you. They're all things we don't like in other people. And so what we've done is to externalize it and say, oh, they have a disorder. Okay. If you're somebody who works with words, all of you are works with words, you know, it hurts, it consumes thoughts, it creates images you can't forget, it wears away resilience, it can make you pull away from other people. That's part of avoidance. You'd rather be alone if you want to keep the covers over your head. It can make you question your faith. This is what happens to children and people on the battlefield. The question of faith. Because where is God at the moment that they're being sexually abused or in the middle of the battle? There's a famous book from veterans, it's called God is Not Here. And it's talking about this problem. God is not here. If you're 6 inches one way or another, the difference between life and the whole thing is hard. 6 inches is all. And you can get 7. So, mirror neurons. Right on time. These are things that allow us to imitate other people. Okay. If you, how many people have kids? Okay. You know that within 24 hours of your child's birth, they start imitating you. If you open your mouth like this, they will try to open their mouth. How do they do that? They're just born. They can only see 8 inches. That's all they can see. And yet they're imitating you. And they're imitating you with mirror neurons. That is why modeling is not about what you say. It's about what you do. We imitate the behavior of others, whether they want us to do it or not. One of my patients told his sons, told him, never, ever, ever go into the military because of all the traumas that he experienced. Both of them went into the military. Why? They did what they saw, not what was said to them. And the terrible thing is that one of them attempted suicide, and the other was homicidal to a staff sergeant and had to be pulled out. The staff sergeant was okay. Mirror neurons. So, they make up about 10 to 20% of neurons that actually exist in certain parts of your brain. Often they're fairly deep in the brain. And they're responsible for, as I said a moment ago, empathy. And here's an example. These are 2 brains. This is a brain of a person who is watching another person who's in pain. They have electrodes on their head so you can see where the activity in the brain is. And the person who's in pain, that's where it is. And guess what? The 2 big areas there are similarly lit up. Not as big. Empathy doesn't mean you feel exactly what someone feels. You feel. Feel. And you can see that in babies as young as 6 months. You can see that responses to babies. Or, interesting, small animals. So, here's examples of what is secondary traumatic stress. These are judges, and they were quoted in Judicial Edge. Are you all familiar with that? No? It is a magazine, newsletter, yeah. And they had an issue in 2017 about secondary traumatic stress in judges. And here's what one of the people said. We're not able to unhear or unsee the things we see in the courtroom. There's no button to turn this on. Here's another one. I'll be out writing, and I suddenly see this burned off face of a 5-year-old child. It feels not. It's not being triggered by anything. He just saw it. Actually, it is. He doesn't know. But because I know it happens. What's he doing? He's out running. So what's happening? His heart is beating faster. He's sweating. And now he's having similar physiological responses to the physiological responses he had when he saw that picture in the first place. It reminds him of it, and now he can't get rid of it. So when does he get rid of it? Well, it's going to take till his body calms down and the trigger is gone. So even something like that can trigger it along the way. You have to learn what you want. That's the reason. We all have triggers. We all have to learn what works and what your responses are. But basically, I said to you, the PTSD was about having a normal response to an abnormal event. In this case, love exposure to risk factors. Okay, now we're going to start getting more personal. I am not going to ask you if you have these or not. These are all things you need to think about in you. Most important is a personal history of trauma. People who have personal histories of trauma are sensitized to similar traumatic events. Okay, and so that may, there's a case that you're working on, and it has something in it that reminds you of something that happened to you, or something similar. Yes, it does. Over-identification, of course, participants. And everybody goes, I don't over-identify. I'm sitting there and I'm doing this talk. I'm in front of a bunch of judges. And one of them says to me, well, the judge announces that he's gay. And he tells us that he had a gay participant in his treatment court, and he tried to be helpful to him by giving him information about a gay pride event and offered to march with him. That is over identification with that person. And by the way, if that ever happens and the cat gets out of the bag, and the cat is on in the treatment court, because those people all tell stories. Okay? So now that judge will forever be known as the gay guy who, went with his participant. I mean, this is one time, the horse left the barn burned down. Everybody knows about the horse. Having an empathic style, my youngest child really has the gifts one needs to have to become a therapist. They absolutely will not become a therapist. And what they say is because they are an empath and they feel other people's feelings. Now, does that mean that they have more mirror neurons? It's possible. I don't know. We don't even have mirror neurons in the brain. They do a lot of other wonderful things, and they are very therapeutic and take care of other people. So they do it. Insufficient recovery time between trauma exposures. I sort of showed you that. That's why things like being in a home where there is a stepfather or a mother's boyfriend who is sexually abusive is so bad, it's like being in combat, because you don't get any recovery time. Reaction to children's vulnerability. If you're one of those people that strong feelings about children and their vulnerability, that can make it more difficult in the case of your child, children involved. Becoming isolated. This is a really big problem in law. And it's the worst for the judges. The judges are the most isolated people I ever met. And I do spend a lot of time with them. funny things that happen to all the judicial processes around the country. And I always give my admit, and it's inevitable that one of them is going to happen. Because there is nowhere safe you can go to talk about what's going on. And so I have a version of this that I do for judges only. And I tell them, here's the story. And the short answer is the judicial. They have lunch every 2 weeks on a regular basis. And they talk with that person about what it's like to deal with the stresses of being in court. And then I assign them, I say, here's your homework. You're not allowed to leave this judicial conference until you have set up something with the judicial body. And I'm always amazed because judges are the ones who want to keep the court. But then I find out how many of them actually do it. I mean, I don't know what the percentage is, but a lot of them really do it. Because it's like, oh, somebody pointed out something that, I don't know, to me it seems obvious. To me it's somebody, everybody needs someone. Lack of systemic resources. We really suck when it comes. I'm sorry, we suck. Think about it. Any of you ever been part of a jury trial? You know? Okay, we expose our juries to traumatic events. What are we doing for the juries? That's a huge problem that we do not think about systemically. So it's not just you all who can get secondarily from it. It's juries. What resources are not that we have an obligation? We don't have. How do you know the history? And yes, you know something about them, but nobody. They don't ask you. Nobody ever asks you. What is your trauma when you're screaming? They don't. These are the symptoms. It's really, all I did was really try to put them in the same post-traumatic stress categories that people do. Late to work, missing work, not going out in public, drug use, all of that. But these are the same kinds of things. Yeah. Now, there are other things that people get from secondary traumatic stress, which aren't necessarily post-traumatic stress, but eating habits. You know, it's really interesting. This is the first room that I have been in years in which nobody in the morning has a soda. I'm amazed at what has happened in our culture. People drink soda. You know what I'm talking about, right? You have soda in the morning. What's that? Sugar. I mean, caffeine. Not good though. Not a good thing to have soda. Junk food. And I'm saying this so you can learn some of the things you know your own self. When you're under stress, you like 3 tastes. You know what they are? So, sugar, salt, fat. That's it. Okay, sugar, salt, fat. Okay. And we are programmed for that. It's a biological thing, actually, from evolution. We need sugar from winter. We need fat for the winter. We need salt. And so sugar, salt, fat. Walk into any convenience store. It's all sugar, salt. All of it is sugar, salt, fat. Walk into any grocery store. Count how many aisles are sugar, salt, fat. Okay? So under stress, the tastes that are good, that we like, are amplified in all of our junk food. Sometimes I think the more of these aisles that we have in the grocery store, and it's an increasing number, means that we're more stressed as a society because we are selling more food that we crave at those moments. Beware sugar, salt, and fat. There's a great book that's actually called Sugar, Salt, Fat. If you really want to know how the companies actually have designed these foods, they've really designed these foods. They have all sorts of special names and taste levels It's designed precisely. Ruminative thinking, that's washing machine thinking. You go around over and over and over again. And all the attorneys I know are really good at this. I've never met an attorney who doesn't do ruminative thinking when they're thinking about a case that they're trying to stop. Thoughts of retribution. Sometimes you want to vengeance on that person who was the abusive one. Fears for your own safety and that of your loved ones. You work longer hours. You engage in excessive screen time. Okay, this is one of the worst things we can do. Okay, there's a direct relationship between the amount of screen time you have and depression and anxiety. Okay, and so let me tell you. Anybody know what the average number of hours we spend on the day just on our phones? I'm not talking our computers. Screen. An idea how many hours a day we do? 8. 8 hours a day. And no, your phone isn't telling you right. I can tell you that because I've looked at my phone and it tells me, oh, you've been on the screen for X number of hours. Every hour, over 1 hour a day that you spend on a screen, that includes TVs, laptops, etc., increases your chances of becoming depressed and anxious. And by the time you get to 8 hours, yeah, it's really bad. Which is why we tell people, when it comes to news, do not spend more than 1 hour a day on the screen. Do not. And when it comes to news, I will advise you to read about it. Don't watch videos of it or see pictures of it. Why? Because a picture is 1,000 words, and a video is 10,000 words. And those things stick in your brain much more than reading. And while you may react to things that you read, your reactivity level is low. And so, no more than a no more, and preferably red, not green. That's my advice. I'm giving it to you right now. Yes.
I read a lot on the Kindle app on my phone. Does that layer into the number of hours on screen, or
Well, depends what you read.
books, just novels?
Depends what kind of novels.
Oh, usually romance.
I
I like hearing that one.
there's always a part in romance novel.
I know, but
It's a rule of 100% of the
that's also a rule of 100% is that it will be mine by the end.
So yes, you can read that sort of thing. That is not what I'm talking about. I'm talking about movies.
Yeah.
Why the more stressed I am I more interested in the more horrible horror stories and murder mysteries. The more stressed I am, the worse things I find.
Yeah, my wife is really into murder mystery TV shows, and I can tell how stressed she is by how much of those she's watching as opposed to something else. Why? Because unfortunately life seems and that's really what it boils down to. But I was thinking if I'm an alien and I were to come to the United States and float my ship above the United States and I was here between the 9 o'clock and 10 o'clock hours, I would think that all people would do is kill each other and figure out who to get. Because 9 to 10, that's all that's happening. I mean, okay, sometimes there's a hospital. Shit, right? But people are at risk of dying in the hospital show. I mean, that's a rule. Somebody has to be close to death in these shows. Between 9 and 10. There you go. I do have advice about that. It's okay to watch sports. It's okay, although I would tell you, preferably not the really type of violent sports. Things like boxing and MMA, those kinds of things. These people do that. So that's another thing. Musicals are great. Musicals. For those who like musicals, musicals are a wonderful thing. And everything else, and you'll appreciate this one, should be rom-coms. Everything else is rom-coms. Those are what is safe to watch because they will not bring your stress response to bear. And everything else, I want to say something in case some of you are feeling like, oh my God, I'm a disaster. Dr. Myers told me all these things, and now I realize I'm in really bad shape, and I didn't know it before. It is normal to experience these things in life for limited periods of time. However, normally those don't last longer than 2 weeks. You're finding that it's lasting longer than 2 weeks, then you got to do something. Which is one. Resilient. There it is. So this is what I think of as the green light. This is when you're okay. This is that green end of the spectrum. These are the things that you do. So, what do? Well, first of all, you have to know these are Samson's 4 R's. You have to realize the trauma-informed. You have to realize the widespread impact of trauma and understand potential paths to recovery. You have to recognize signs and symptoms of trauma participants. That's a trauma-informed course. Those 2. Because these are trauma responses, integrating your knowledge of trauma into policy, procedures, and practices. And the only thing that Samson's ever said, published about trauma response course, says explicitly that. And you have to actively resist re-traumatization. There's rule number 1. I told you it's rule number 1. Never, ever, ever ask anybody, a participant, to share the details of their trauma in open court. It violates the boundaries. Right? Just what you need to do is get somebody traumatized and re-traumatize. It shames them because most people feel shame for what happened. It can re-traumatize them. It can trigger other people in the court, especially in treatment courts, where we have lots of people, 90% or more, who have experienced trauma. So if you have a participant, like if you have a client, maybe you do defense attorney. No? Okay. Well, you know, that's interesting. Okay.
What are representing parents in child foster care?
So, you can trigger other people in the room, not only participants, but other people who are on the team. I mean, you think, does anybody know of people who at age 5, when asked what they want to do when they grow up, is they want to go work with DWI participants and help them? Or, I want to go be a children's court attorney. You know what children's court attorney means? You know, I say that to say, I've been doing this for a long time, working with folks for a long time, and I never surprised by the amount of trauma that exists in the court team. I'm never surprised. The amount of trauma that exists in this team. People do these things for a reason. I told you, I am a child of a Holocaust. What have I spent my life doing? Working with people who've been traumatized. We don't get to escape this stuff. Okay? And what we do have to do is learn how to manage this. I have seen people who've done this work and they cry. And I have been doing this work for 34 years and haven't tried. And I'm trying to make the system better. And I'm trying to do it on a national level. But I know how to do these things because I'm a psychologist. So this is what's important. We're going to prevent sharing details. We will decrease secondary traumatization in our programs. We will decrease triggering people. We will decrease compassion fatigue in those who work in support, and we will decrease all of them. So what is resilience? This is the American Psychological Association's definition, the process of adapting well in the face of adversity, trauma, tragedy, threats, and significance. Adapting well. That's what it's about. It is ordinary. It is not an extraordinary thing. Everybody can be resilient. Not meaning you don't feel distress. Doesn't mean you don't get upset. And it is not a trick. It's about what your thoughts, behaviors, and actions are. There are 6. If you pick one scene, picture, one slide and one slide only, this is the picture to take. Okay? Because this is what you've got to do. Number 1. And this is number 1, the big number. Most important is to have supportive relationships inside and outside. Okay. And that means not withdrawing from relationships, which is part of that avoidance that people do. They cocoon. No, it's the opposite. And so having supportive relationships is the most important thing. And I do believe, regardless of what your profession is, you need one person in your profession to be that every 2 weeks. Every 2 weeks. If there's a person in your profession who sees you that you want to do an every 2 week lunch with, you're willing to do it. Great. But if you've got somebody else in mind, that's great too. But I'm giving you an assignment. Sorry. You all. It's really important to have somebody who knows what you're going through. And you can talk to them. The capacity to make realistic plans and take steps to carry them out. Having a positive view of yourself. Now you've got to start thinking about what does your brain say about you? What's your mind saying to you? And we all have negative scripts. Most of our negative scripts come from a fairly young age in our life. Fairly young age, but trauma itself about negative scripts that people have. And they just play over and over and over again. They're the primitive Washington machine thought. To have maintain a positive view of yourself and your confidence in your strengths. And by the way, everybody needs this, no matter how positive they are, that you remind, no, you're really great. Let me give you examples of all the times you've been great. And so when you say that about yourself, I see that as true because it does not fit with your behavior. That's what we need this person for, to remind you of those things. Skills in communication and problem solving. See how all of these sort of go together, right? They really all except for number 6. The capacity to manage your strong feelings and impulses. And sometimes we have impulses to do things which are not a really good idea. And those impulses are coming from the amygdala, and it's telling you to do this, and it might not be the right idea. How many of you ever want to punch somebody in the face? Right? Do you always punch somebody in the face when you feel like doing that? No. There you go. You got it. You got it. Engaging in self-care is the only one that doesn't fall into that level. This is something you do for you. So now I'm going to define that for you. You must do something nice for yourself. Get this. 1 hour every day. 1 hour every day. You can do more than 1 hour, that's okay. But you have to have 1 hour to do something nice for yourself. Because if you don't do something nice for yourself, what are the chances somebody else is going to do something. I love my wife dearly. I try to do all I can, and I let her know every day. But is that an hour of it? No, it's not an hour of it, you know. We like everybody else, lead busy life. An hour. And that means an important thing. Schedule. You must schedule that hour. Because if you don't schedule something nice, what are the chances that something nice is just going to pop up and happen to you every day? Every day. None. Yes.
And could you break up the hour? Or is it just meditation or something, or does it have to be a full 1 hour thing? Or is it what's the suggestion?
If you go and you exercise for yourself, take care of your body, half an hour to raise, your heart. You can do something else with that. You can do things like that. I wouldn't recommend you do anything more than 2.
Okay, fair enough.
Because you don't get anything, you don't get enough of the good enough feeling that you need to have. You can meditate, you can do yoga, and I'm going to talk about the things that you can do in just a second. The point is that these are all cultivatable. You can do these things. You can practice these things. You have to talk to, the negative voice that sits in your head and go, oh, that's an old tape. I'm going to turn the volume down. I know I've heard that before, but it doesn't really apply to my present. It may or may not have applied to my past, but it doesn't apply to me today now. You have to talk to that. So, how do you know? How do you know when you're starting to have trouble? And what you do is you have to self-assess. So this is called a subjective unit of distress scale, also known as a SUDS scale. Can be confused with SUDS, which are substance use disorders. You get confused between those two. But it's a distress scale. And basically, you can do it from 0 to 100. You can do it from 0 to 10. That's fine. You have to rate yourself. How am I doing right at this moment? How am I doing right at this moment? So go ahead. I want you to take a moment and to look inside and ask yourself, on a scale of 0 to 100, where 100 is the worst feeling you've ever had, and 0 is you're just fine. Where do you like now? Now, low distress is basically 0 to 33. Moderate distress is basically 33 to 67. High distress is over 67. And that's where you are. Where do you need to intervene? Notice I'm talking about resilience, but where do you need to intervene? 34. You can manage 0 to 33. All of us can. Manage that 0 to 33. You start hitting 34 and up, and you need to do something to manage. So you do that anytime. Here is an instrument. It is a free instrument. I have a link to it in the back of the presentation in the resources section. Does anybody have copies?
I will put them on the website.
I get it. Believe me, I get it. So this will be available to you. Okay? The professional quality of life, or the protocol, is free. It is always good. And it basically breaks things down into compassion, satisfaction, and compassion fatigue. And how you are doing is usually the balance of those two things. Because, the work you do is really, really important. And you may get a lot of self-confidence, self-esteem, and just pleasure out of your job. And that's great. And there's the other side. How tired does it make you? Emotionally tired, usually, is where it starts to go. So it's the balance of those two. And compassion fatigue is further broken out in this scale between burnout, which is like, it's like too late, you need to change professions, and secondary traumatization, which is what I've been talking about today. Because secondary traumatization is often the precursor. It's a very nice assessment. I recommend that you do this one every 6 months. Every 6 months. Why? Because you gotta check in with yourself. Now, if something has happened and life has changed at your work, you may need to check in with yourself at the point when life has changed and say, wait a second, I'm not feeling like I felt. You know who knows you best? It's usually your partner. They can see things happening to you. You cannot see yourself. A fish does not know the water in which it swims. You don't know the water in which you're swimming. But you can ask your partner, or it could be a sibling you're close to, or it could be your best friend, but somebody who you see frequently, who knows you really well. And if you have, when you have a person like that, you should ask them to say, so what do you notice about me over the last 6 months? You think I'm pretty much staying the same? There's some changes in me. What changes do you see? If you see any changes, they'll tell you. That's the great thing about having those people in your life. They may not tell you free-handedly, well, gee, I noticed you changed. But if you give them the opening, yeah, okay. So they are a great assessor. There are way too many words we toss around in this field. We also toss around vicarious trauma. That is really secondary traumatization. We toss around compassion, fatigue, but that's often confused with secondary traumatic stress. I'm just saying, whatever these terms are, we're talking about the same thing. It doesn't matter the label that we put on it. You have to assess this thematic safety concerns. You know, we live in a world, you know, it happened here, I saw it in the news, where judges, especially, are now targets of violence. And I certainly also know people who have, for example, lost their children, lost custody of their children in the state, and they blame their attorney. And so the attorney if you testify against somebody as a parent in court, I had a colleague who testified against a parent in court, and that person started leaving dead animals in the mailbox, started following home from work. This got so serious, there was explosive ones in the mailbox. It got so serious that they had to move into a gated community. Completely whole life. Anything you can do to make your courtroom safer is better. And here is the National Center for State Courts safety practices. That is important, but also you need to take steps to make sure that you are also safe in what you do. Because otherwise, your life can get really turned upside down, like one incident, just one incident. Oh, by the way, one of the safest things to do for this is a trauma responsive court. Parents down to be 65. 65. You want to know why that is? Well, it has to do with the notion of heat. And when somebody gets angry, we say they get heated or they have a hot temper. And we don't hear that about cold. Have you ever really heard that there's a riot that happened in wintertime? Riots never happen in winter. They always happen in summer when it's hot. If you keep your courtroom hot, what you're doing, you're making people sweat, makes their heart beat faster. It's the same thing that I've been talking about all along. It's no different than standing on the edge of the dang cliff, especially when you've got violent people. Especially. What do you need to do? Turn it down. Why? Because it's really hard to get heated when you're cold. It really is hard. It's a very simple thing you can do. I'm really going to give you practical things that you can do, that you can implement. You have to talk to your judge about it. But it really works. It really works. I've talked about the first two of these. How else can you prevent secondary traumatization? We're going to 11. We're going to 11?
Yeah.
Okay, I'm going to go fast. Really fast. Take breaks at work. What does that mean? It means that there's one thing you can learn from cigarette smokers. And they somehow managed to get all the same amount of work done. I've always admired them. I don't smoke, and I don't really want to smoke, but I do think that take breaks better than all the rest of us. You got to get 6.5. This is the doctor's solution, right? Make sure you get 6.5 to 7.5 hours of sleep a night. If you're not getting that, you may need to see somebody. Including somebody like me who knows how to deal with sleep problems. Eating healthy foods and healthy amounts, exercising regularly. Okay, I think we can take care of the doctor. Now, so this is, I was always amazed because when I lived in Ginsburg, she was like 84, 85. And she worked out every single day. I've seen videos of her working out with her trainer. She can do one-handed push-ups and sweep her hand. She could. Underneath, I've seen her do that live. I can't do that. Can you do that? Can anyone do that? I mean, that's amazing. That is really amazing. Yeah. So engage in a spiritual life. Notice I am not saying engage that you have to engage in religion. Lots of people have some feelings about faith. Feelings about faith have changed a great deal in the last couple of decades, I would say. But you must have a spiritual life. And a spiritual life means you can recognize that there is something bigger than you more. And so you're going to go look at sand dunes. I go look at the mountain and I go, that's amazing. That's a mile high mountain. How did a mile high mountain get there? I mean, it's really incredible. Experience awe. Engage in a hobby that has nothing to do with work. Nothing. When I go home, I do not read work books. I really don't. Why? Ooh, I see a lot of people looking at me like, what are you saying? I can tell who the ones are who actually do. Take their work home. Listen. We home not if we take our work home with us, there are no boundaries. Now, if it's done occasionally, that's not a problem. I'm not saying never, ever, ever, ever. Of course, there are times when there are high levels of work, and there are times when there are lower levels of work. If you're one of those people who's going home and working every single day, or most days a week, until Friday again, that's a problem. You gotta have a hobby. Set boundaries between your work and home. I learned how to set boundaries here when I was driving from Albuquerque to Santa Fe every day for my work. And I'm going, this is too much for me. And I started listening to audio. And because I was listening to music, music wasn't doing it for me. And so I started listening to audio. And I suddenly noticed that by the time I was home, I wasn't thinking about working. I had changed my meditation to a new channel. I recommend it strongly. It's really good. You need about 15, 20 minutes of it to do it. Schedule and accumulate pleasant activities. I can talk about that one. deal with the personal history, if you do have a history, and you have not dealt with it, you're vulnerable. That's what I was saying. Please deal with the personal history so you're not affected by a historical. And what this is, training in trauma and its effects. Believe me, there's a lot of them in there, about 60 hours. It's really scary. Responding to traumatization, remember I told you if you're 33 or above, this is the quick. You better engage or re-engage your support network. Remember I said that was the number one thing. You have to rebalance your work and your life. And you have to reduce your exposure to trauma-related stuff. I have stopped watching trauma-related movies. They can be the best movie in the world. I won't watch it. I won't watch it. Because I know what that will do to my body. And much as I love, really well acted movies, I don't need exposure. Practice self-soothing. Take baths. Get massage. Listen to music. Smell scented candles. Like the smell. Do things that are soothing to you. Hug somebody for a long, long time. Pet your dog for 20 minutes. Why 20 minutes? It doesn't work with cat cycles. Your dogs for 20 minutes. Your heart rate lowers. Your blood pressure goes down. You move into your parasympathetic nervous system and you are calm. Everybody should pet the dog for 20 minutes a day. That counts among that hour, right? And so you can spend 20 minutes petting your dog, and then you can do something else for you, okay? And your dog will love you. Take vacations. Okay. No, I have to get explicit about these things. Let me ask you this. How many of you have not taken a 2-week vacation in the last 3 years? Most. How many of you did take a 2-week vacation? Wait, hold your hands up. Hold your hands up. Look at those people. They're doing it right. So I am going to tell you, here's the rule. If you haven't taken a vacation in the last year, you need to split it up. You need one 1-week vacation a year, and every 3 years, you need a 2-week vacation. Yes, now you can go to your boss. And you can say, gee, I listened to this psychologist, and he's an expert in trauma, and he said to me that I need to take a 2-week vacation. How about it? You need to do that. Absolutely. Start a gratitude journal. Anybody know what a gratitude journal is? Many of you do. You write down 3 things a day. They have to be different things. You have to do it for 21 days. It's 61 different things you're grateful for. The effect of the gratitude journal is so powerful that it equals using an antidepressant for 14 months. So you can do a gratitude journal for 3 weeks, or you can take a pill for 14 months. It's your choice. And people get mad when I say this. They're attorneys. They're attorneys. So I did a conference. There was a conference the week before in Orlando, and then the conference was actually in Albuquerque, of all places. And there was this attorney who was at both of them. So she heard my spiel about this. And at lunchtime, we sat at Padillas. I brought up everybody. Lunchtime, she sat at Padillas. She said, I am so mad at you. She said, I was going to prove you wrong. So she did a gratitude. And on the plane over to Albuquerque, she noticed that the seat next to her was empty. And she could put her stuff on. And she felt grateful. And she said, I am so mad at you. You were right. It's about attorneys being opposition. We live in this system, where we have to argue with other people. But it worked. It did work. Be creative. Remember what I said about creative juices. Okay, so you got to sing, dance, act, do whatever. Write stories. Spend time with healthy children. So here's my piece of advice: have grandchildren. Everybody should have grandchildren. I have 2 grandchildren, age 1 and 5, and I want to tell you, they're nothing but joy. Even when they're not so good, I love them dearly. You know what? And they love me no matter what. They love me no matter what. They get mad at their parents, they don't get mad at me. You know, I mean, it's the best thing. And you know, if they're ever, screaming and yelling, you can say, hey, you go home now. I mean, grandchildren are the best thing. Now, I don't know what that says about kids. And I love my children here. Don't get me wrong, my grandchildren are so much easier. They're so much happier. Practice self-compassion. Nice to do self-compassion. Very hard on yourself. Practice mindfulness meditation. Even dogs do it, right? Even dogs can do it. You can also practice yoga. And dogs can do it. I had a dog who said her pose with the Sphinx. Very. She was beautiful. She thought she was. This is just some data about mindfulness and yoga. So, know when your cup is running over. When it is, you've got to practice self-soothing through the 5 senses. Everybody, as I said, one person in one different body. It can be your spouse, your partner, your sibling, your best friend, therapist, priest, whoever. It's fine. But if you don't have one, you have to have it. Because otherwise it wouldn't work. Because you're just continuing. That's what you do. I did talk about that before. Develop a self-care action plan. So I've just given you a lot of ideas. Divided into 4 categories: mental self-care, physical self-care, emotional self-care, and spiritual self-care. Do every week, set up a plan, and you have to get one of those categories every week. So that takes care of 4 of them, and then the other ones you can just add. So that's really important to have a kind of plan. How long do you have? Today is Tuesday. You need to plan by Friday. You know why? By Friday, you will have forgotten 75% of what I said. 75%. Unless you get started and you start doing it. Take away from what you've heard from me today. You can do other things, and it's not an exclusive list. There's lots of things that you can do. But you have to take care of yourself, because if you don't, nobody else is going to. It's not just going to magically happen. And finally, please recognize when you need outside help. It has to do with using substances. It has to do with being stuck on your screen. It has to do with not sleeping and panic, isolating yourself, feeling despair constantly about the world, losing faith, lots of suicide. Or you can lots of things start happening, but you really need to use the resources that are available. There are state system programs for trainers, including in Mexico. And then know what burnout is. Because when you hit burnout, that's the end of the road. If you burn out, you may be done on your career, but you certainly have to change what you're doing. My favorite children's book was here in Albuquerque, and we worked together, and she was extremely right. She did it for several years. And she was very empathic, and she was very open and caring about kids. And one day she bought a farm, and she moved to the other part of the state. That was it. Three final thoughts. Number one, do you let your phone run out of charge? Right? Well, you take pretty good care of your phone, right? And when you do, don't you get mad at yourself? Oh, how could I have done that? Oh, I need that. No, self-care is a priority. It's not a luxury. Number two, you have an obligation to our clients, ourselves, colleagues, loved ones, not to be damaged by the world. Ask yourself, because if you are, you have to start doing things. You have to start doing it. And please, keep an eye out for your colleagues too, because they may not know. They may not know this. Finally, remember, if you are going to help others, you put your oxygen mask on first. Give a final plane. You know, they always say, and we ignore this, right? We've heard it 1,000 times. No, they always say, put your oxygen mask on first. You cannot help anyone else if you are not taking care of yourself. Can't. Fly. I have put a bunch of resources in here that I've mentioned, things that can be helpful. Why? There are apps to do it. Really good. And if you read, that's how you find it. Thank you very much.